the most annoying and frustrating disease around. Really, it is. Ask any patient, ask any family member, ask any carer. The reason being is because you can't handle it. You can't really control it. It gets progressively worse. The patient's going to become a nobody at the end in the institution and not knowing his name, where he is, who his family members are. It comes at the wrong stage of your life. Hits you around about 60 years of age, 55, 60, just when people are getting retired and want to spend the rest of their lives with family and friends. And then you get diagnosed with this disease that's depleting your memory. Worst of all, as well, is that doctors, when they diagnose you, they just say it's because you're getting old, or your family history, or genetics. In return, they give you they medicate you, make some money off you, and because that's not going to cure you. The medication doesn't cure you at all. There's no one that has deep set or late onset Alzheimer's disease and gets cured with the medication that's provided today. Nothing. You're just going to die a premature death. So that's it. But for people that have it, and there's hope. There really is, because a number of years ago, and I don't know why it has not been publicized more, but most likely because of government and pharmaceutical company interference. But a few medical researchers did a research and diagnosis on this disease, and they found out there were traces that was evident of this disease in younger people at around 30 to 35 years of age. Now, majority of the time, everybody gets diagnosed around 55, 60, but that's the common one, but age group. But as young as 30 to 35 degrees, years of age, this is amazing, because this proves, and it's been documented and published, that this disease is very sneaky. Because even though these young people had the symptom, it didn't have immediate memory loss. Okay, and this proved that this disease is very sneaky. It actually progresses very slowly through the human body and the brain. And round about, say you get diagnosed with 30, 35 years of age, around about 40, 45, you start forgetting things or just putting aside. And comes around about 50 odd, you start noticing that you're forgetting things, but you just put it off till you're getting old. And while you're doing this disease is sneakily progressing, and it gets to you about 55, 60, you're done. Majority of the cells are depleted. Okay, and you just put you on medication, you're done. So this was a good find in this research, finding evidence in very young people. And this gives us an opportunity to implement cure and preventative measures at an early stage or infancy stage of this disease. It's brilliant. But furthermore, they actually found out that in this report that 80 to 90% of people that have Alzheimer's disease are stage 2 diabetic. In other words, they're insulin resistant, which is remarkable, because we all know, and it's a fact, that the root cause of most of our chronic diseases that we have today, including heart disease, cancers, clogging of arteries, high blood pressure, etc., is due to insulin resistance. They don't tell you that, but that is true. It's a medical fact. So knowing that this is Alzheimer's disease is directly linked to diabetes or insulin resistance is amazing, because that gives us even more information how we can implement some preventative and cure measures. It's awesome find. It's a great research. So they even gone further to rename Alzheimer's disease, and they've given a new name, which is stage 3 diabetes. Can you believe it? So we've got stage 1, stage 2, stage 3 diabetes. Stage 2 is the diabetes of the body, and now we have stage 3 that contributes to mental disease. Awesome. So great research and find this. So because of its link to stage 2 diabetes, let's just recap what it is, because a lot of people have Alzheimer's disease or even diabetes don't really know what it's all about. So stage 2 diabetes is, quickly, just a recap, is when the body becomes insulin resistant. That means your fatty cells and muscle cells are resistant to the overflow of glucose in your body. Now, the reason this being is because every day, every year, every day, every week, every year, every decade, you're continuously consuming 3 to 4 times a day, especially in the Western world, because they're 50% insulin resistant. Can you believe it? You're continuously consuming refined carbohydrates, sugars, and liquid sugars every day of your life in all forms and fats on drinks. Okay, you are doing that unconsciously, all right? And the reason is because this is happening is that when you consume these foods, it gets digested and gets converted into glucose. All these foods that I just mentioned gets converted to purely glucose. So your body starts getting a glucose spike. It gets an oversupply of glucose in your body. Now, your body always likes to keep your bloodstream in a balance of glucose and insulin. Okay, it likes to keep a nice balance in the bloodstream there. Okay, but now you start to give a continuous glucose spike. And when this happens, the pancreas releases insulin. And insulin's job is to actually remove the excess glucose from the bloodstream into fatty cells and muscle cells to store as energy. So when there's an oversupply, the insulin unlocks the doors of these cells and transfers the excess glucose into these cells to store as energy for you later. And then it brings the um, uh, your blood to an equal level of insulin and glucose. But now you're troughing down. You continuously troughing down every day, every week, every year, every decade of your life on these foods. So you're given an continuous oversupply of glucose in your bloodstream. And now there's a continuous overflow of insulin because your pancreas is just releasing more and more insulin. Now your cells, those fatty cells and muscle cells, become resistant. They become insulin resistant. They don't want any more glucose. They've got enough in the cells. You're not using them enough for energy. So now they become resistant to the insulin. Now you've got an oversupply of glucose and insulin cruising around in your bloodstream, through your artery system, through your whole body and your brain continuously. It's going nowhere. And this when trouble starts to happen. This is when you start getting your chronic diseases. All that glucose starts piling up in your blood vessels and your bloodstream and gets clogged up, and you get clogged arteries. Then you get a heart attack. Then they put a stent in. Then you start getting mutations in your body which turn into cancer. You get liver cancer and skin cancer and colon cancer. And this is how it all happens. High blood pressure, clogging of the arteries. There you go. Get insulin resistant, become diabetic, you will have these diseases. You will get it without fail. And that's stage 2 diabetes of the body. How does it affect the brain? Well, your brain actually demands a lot of energy. It's always busy. And it's busy when you're sleeping, busy when you're awake, it's making decisions, so many decisions for you, millions of decisions every day for you. And it dissolves a large amount of glucose for energy in order to perform at an optimal level. Okay, very busy. So now, unlike in the body, the glucose has a kind of a Brexit-free visa. That's how I like to describe it, because in the body, type 2, stage 2 diabetes is the insulin. The cells need the insulin to unlock the doors to transfer the glucose, right? But not in the brain. It works differently. Now, because in the brain, because you got stage 2 diabetes, there's an overflow of glucose and insulin right throughout your body, right? So in the brain, it handles it differently. The glucose here has a free Brexit visa. It can flow directly without any problems from the exit the bloodstream and flow directly to the brain cells and lodge itself in the brain cells. It can enter the brain cells. No problem there. Okay? But what happens is that these brain cells still need insulin to convert that glucose into energy for the cell to thrive and to give the brain energy. All right, so it's very important. It still needs the energy, insulin to convert that glucose into energy. All right, but there are receptors. Now, receptors are like um, little ushers. They're like the concierge at a hotel. They help you get to your destination. Now, these receptors guide the insulin to the various cells that need the glucose to be converted in. Not all brain cells need this. So it acts as a guide. There you go. Off you go. That's where you have to go. That's what it does. But now, because you are insulin resistant, or your body is, stage 2 diabetes, the oversupply of insulin in your bloodstream, now the resistors become resistant to the insulin. So just like in your body, the fatty cells and muscle cells become resistant to insulin. In your brain, the receptors become insulin resistant. Okay. Now you've got all this, a lot of this glucose floating around in the brain cells, and they're not getting converted to energy. Therefore, it starts to shrivel up and die. And this is the early stages of Alzheimer's disease. And we call this now, at this stage, we call it glucose hypometabolism. All right. So that's what happens in the brain. Now, the first the first brain cell to deplete is in the hippocampus. The hippocampus is the headquarters of your memory center of your brain. It controls all the memory, and it also requires large amounts of energy to execute memory tasks. And when it's starved, it starts to shrivel up and die, resulting to memory loss and mild cognitive impairment. Okay, so this is where we find in the research in the younger people, they now have early stages of glucose hypometabolism, right? And when this happens, already 10 to 20% of the hippocampus memory cells have depleted already. It's astonishing. But still, it doesn't give evidence of memory loss yet, just yet. It's starting. It's happening, but it just doesn't give it evidence. That's how sneaky this disease really is. All right? So already between 10 and 20% of memory cells have already been depleted. So therefore we know now, say that glucose hypermetabolism is the early notification marker of the early stages of Alzheimer's disease. Right, it's a given. Okay, so this research has helped us immensely how to approach this disease from now on. Now, knowing this, we now recommend that anybody that goes to a doctor and has a glucose or sugar test and is very high on the spectrum of becoming diabetic, or either diabetic or they're very high, very close on the spectrum to become diabetic, we strongly recommend that you have a PET scan. This is digital scanning for glucose hypometabolism. Really, it's very important. The reason why we're given it stage 3, the name stage 3 diabetes, is because it doesn't mean that you suddenly got diabetes 2, stage 2 diabetes. That means you're getting glucose hypometabolism in the brain, in the hippocampus. No, you don't have to have that. You can be high on the spectrum. You can have a high level of glucose or sugar count in your body, and you still can get symptoms or evidence of glucose hypermetabolism in your brain. Okay, so it doesn't mean you're having stage 2 diabetes, you're going to get early onset Alzheimer's. Not at all. So that's why we recommend, if you're in a high spectrum of sugar count, or if you are diabetic, you get a PET scan for hypermetabolism. All right. It's very, very, very important for you to do that. Now, because we know this knowledge now. So once you get diagnosed of one or the other, we normally would go on medication like galantamine or donepezil or benzogalantamine, etc., what these doctors prescribe, and it doesn't work. We've seen it in patients; they just get even worse. It's like cancer patients take on radiation therapy. They just look horrible. They don't deal. They don't get cured. Um, People have diabetes. I mean, they're on prescription every day of their life. They never get cured. Okay, so therefore, we recommend once you get diagnosed either or for hypometabolism, or if you've been diagnosed for diabetes stage 2, we recommend that you go on a high fat, high protein, and low carbohydrate diet. Done. Okay, it's been proven. It really has been proven. It's published. The people have actually diabetes or Alzheimer's disease. They go on this diet, and within 2.5 weeks, the diabetes markers have dropped considerably, as well as to norm, as well as there's a huge improvement in memory in Alzheimer's disease patients, as well as stops the progression of the disease. It's proven. So it makes sense because the only reason why you got stage 2 diabetes or Alzheimer's disease or glucose hypometabolism is because what you're putting inside your stomach. It's what you're eating. Medication is not going to stop that. It really doesn't. That's why it doesn't cure you. The only reason why you got diabetes is because of what you're eating. And those refined carbohydrates, sugars, and liquid sugars that you continuously eating is giving you that disease. Diabetes is not a disease. Your body just doesn't give it to you. Alzheimer's, it just doesn't give it to you. All right? It's all to do with what you're eating. Because the reason is our bodies aren't equipped to handle modern processed carbohydrates like flour and sugar. These refined carbohydrates cause brain damage. Even nutritionists and your common doctor don't know this. As startling as it may sound, they are there just to push the mainstream pharma narrative or diagnose and prescribe. They're not trained to cure you. A perfect example is people in Africa or in Amazon forest, Eskimos in the north, or Mongolians. I mean, in Central Africa, all these tribes. Do you see these people having diabetes or Alzheimer's disease? Do you see them taking 5 prescription medications a day? No, you don't. Do you see them in hospitals with heart disease? No, you don't. Why? Because they're not shopping every day down the aisle of our toxic supermarkets. All our foods are refined carbohydrate and sugared. That's the only reason why they are not in hospitals, and that's why they're not on medication, and that's why they're long lives. Longevity is amazing there. It's only our Western world. Of course, our Western world is 50% of the population in the West is insulin resistant. It's what we eat, people. Really it is. And you have to take note of that. And it's proven. They just don't tell you. They want to make money off you with the medication. And you're going to die a premature death anyway. So, Jusani, you say swap your to a different diet. It's very difficult because today, to resist the temptation of these processed carbohydrates, it's difficult because they are cheap. I mean, they're tasty, they're addictive, and they taste damn well nice. I mean, examples of cereals, bagels, donuts, white rice, pasta, potatoes, crisps. I mean, when you buy a packet of crisps, you finish that packet. You don't just take 1 or 2 handfuls of it. Bread, sodas. I mean, geez, when you open up a bottle of Coca-Cola, it's not 1 glass. It's like 2 or 3 glasses, especially when mixing with alcohol. Your sweet potatoes, etc., your sauces, table sugar, honey, molasses, energy drinks, fruit juices. They're the worst. And you think they're healthy, but they're not. So, and hard to believe but true is root vegetables. Root vegetables like carrots, potatoes, sweet potatoes, tulips. These guys are, once digested, they give large amounts of glucose. They all wear these healthy jackets, but they're actually not, because when they grow, they store glucose for energy. They really do. So when you digest that, you've got a big spike of glucose coming through to your system. All right, so it's true. Okay, but for starters, I mean, every meal, eat whole foods like meat, fish, poultry, eggs, vegetables, and fruit together. Have a combination of that Every time. Always have protein and fat with your every meal you have because it makes you feel fuller and it refrains you from snacking. Remember, when you snack, it's the sugar ingredient, food addiction that's causing it. And this is a glucose and insulin time bomb for you, especially if you have Alzheimer's or even if you're diabetic, you know. And try have rather have water and unsweetened to your coffee. You have to get used to it. You have to make a difference. You have to make a change. You have to make an effort to make this right and to start making you more healthy, especially if you've been diagnosed. Now, another thing is, they're simple. There's 3 steps to minimize the chances for Alzheimer's disease to take right now. Very simple. Go to a doctor, go have a insulin-resistant blood test for glucose, sugar, insulin, and triglycerides. Okay, and this will give you an indication where you are on the insulin resistance spectrum. Okay, so you're very high, or if you are diagnosed with diabetes, the second step is to have a PET scan for hypometabolism straight away. No matter how young you are or old you are, have it done. It's going to save you at the end of the day when you're 50 or 60 years old, or even 70 years old. Okay. Once you get diagnosed with that, you implement the high fat, protein, and low carbohydrate diet, and you avoid refined carbohydrates like the plague. You really do. You can't afford it. You have to make a change. And it's proven. Within 2.5 weeks, you will find a difference. I promise you, after diagnosis, I guarantee you that. You can reply in the comments. I promise you. Try it. All right. So those are the 3 steps to help prevent this disease. Even if you have it, to help cure it or prevent the progressiveness of it. Okay. Just remember that, with this new intellectual information, it's vital. It's been vital, this research. Really it is, because every time there's always been a later stage of lives when people get caught out with this disease. Now we can stop it in its infancy. But it's your responsibility. When you get diagnosed with high glucose count or you're diabetic, you go for a PET scan, and no matter what age you are. You have to take responsibility for that. Remember, we're born with a long health. We're born with it. But it's only us that choose to make it shorter because it's what we eat, especially in the Western world. The foods are toxic. And that's what's given us these chronic diseases, including Alzheimer's disease. We don't deserve it. And you can stop it personally. Just remember, it's what you eat. Change the diet of yours. If you have diabetes, change your diet. If you have cancer, change your diet. If you have Alzheimer's, change your diet. You have to change it to a high fat, protein, and low carbohydrate diet. You really do. And that will save your life.